Welcome to the Mentor Sessions in OnPoint podcast, where I ask exceptional leaders a series of questions modeled after the Tribe of Mentors book, and starting with professional questions and then going into more personal questions so that you can learn from people who have a lot of wisdom around hard-won lessons and just have a lot of great insights. So I'm excited for my next guest, Sarah Cross, who I've had the pleasure of knowing for well over a decade. I'm going to let her tell you her story, but I've really gotten to see her career flourish over the years, and I'm not surprised by any of her successes. What I love most about Sarah's leadership style is her natural curiosity and this innate approachability that makes you just want to lean in and have great conversations. She's one of those people that you always just want to be around. And she really is leading curiosity first. And I think that makes her an exceptional leader. And I think you're going to really love this conversation.
Welcome to OnPoint, the Mentor Sessions podcast, where the most exceptional leaders in medical affairs share their real stories behind their growth, mistakes, breakthroughs, and leadership journeys. The views and opinions expressed by our guests on this podcast are their own and do not necessarily reflect those of their employers or affiliated organizations.
So welcome to the podcast, Sarah.
Super. Thank you for the incredibly kind introduction. It's such an honor and pleasure to be here with you, Linda.
So we're going to jump into the questions. And the first one is just tell us your story and how you became a medical affairs professional.
Sure. So my story may resonate with some of you out there. I originally was looking for what's my next step in my career. And I thought, okay, let me do what all people do, probably of younger age. And I just thought, you know what, I'm going to Google this. What if I had these qualities? These are the things I'm looking for. This would be my dream job. And I put in scientific education, stakeholder engagement, telling narratives. These are the things I wanted to do. How do you translate the work we do in R&D into meaningful outcomes for stakeholders we engage with, for providers and for patients? And this job came back called medical science liaison. And I thought, how have I never heard of an MSL before? And so then I started to dig into what does that look like? How can I possibly become one of these amazing MSLs that are out there? And long story short, I started reading up on it, right? And there was this catch-22 piece of how do you get an MSL role if you've never been an MSL and vice versa. So really my approach was going to the MSL Society to learn as much as I could and get exposure, and also to reaching out to people that were in my network locally. And one of the first people, as Linda, I reached out to was you. You were the first conversation I had on all things related to medical affairs in a sleepy little town of Evergreen downtown at a lovely coffee shop. I remember the meeting to this day. And not only did I learn so much from you at that time on the role of the MSL in medical affairs, but you left me thinking, oh my gosh, I'm absolutely on the right track. This is what I want to do. And from there, my journey has ebbed and flowed. And to your point, I spent several years as a medical science liaison when I joined AbbVie. And then I was pulled in-house to headquarters MSL roles within different areas of the organization. For some patient-first reasons in my life, I ended up making some career choices to other aspects of industry, which taught me a lot. I went to lead med affairs teams within the CRO side of the business. And where I really love driving change is around seeing, and I alluded to it, seeing that science translated to patients. And so one of the things I got exposure to during my time on the CRO side of our industry was a lot of the patient engagement activities in terms of fostering awareness and inclusion within clinical trials. And I got to know the work that Sanofi has been leading in patient-driven medicines development. And through that spurred an opportunity to join this function, which is unique in the industry, which is really now taking a lot of the amazing work that I would say I've learned and been able to grow from within medical affairs and fostering that in a setting where we really are co-creating and working with patient communities, patient advocacy experts to drive what is value, what is meaningful change for patients, and how can we co-create R&D from very early stages to assets that go to market so that patients are part of development and not just thinking about patient-centric approaches or taking patients' voices in at certain periods, but really making this a co-created opportunity for driving meaningful change and outcomes. So that's a little bit about my story, at least a bit of a 30,000-foot view.
I I really love the story on a number of levels. First is I'm not surprised that you, given what I know about you and you leading with what you're passionate about when you choose your next role, irrespective of what it might be, you're just got the courage to step into something new. I think your role with that is like direct to patient, bringing in that patient voice to the whole product development process is the future of medical affairs. I really think you're in a position that is unique now, but won't be unique 5 years from now. And I've had the pleasure of working with Sanofi as an organization through the acceleration point, and so I'm not surprised that they are very progressive in their thinking. But I think that patient direct engagement is something that we've always wanted to do, but didn't know how to do it in a compliant way. And this makes complete sense. It takes patient centricity, as you said, to the next level.
Yeah.
So I love your story, and I think people will really resonate with kind of the way the industry is heading.
Thank you for that. I'm biased, of course, but I tend to agree with you. I think we're going to see significant expansion in the space, and we already are, even within a handful of years.
Awesome. Okay, next question. What is one decision or mindset shift that positively impacted your career in medical affairs?
This is a great one. I thought quite a bit about this because I've had a lot of, I would say, opportunity to read and learn from leaders or hear from experts who have come into organizations to think about mindset shifts. And one of the things that has resonated for me throughout my career is something very simple, which is what got you here won't get you there. And it really is simple, but when you step back and think about it, it can be so impactful. And so, for example, when I was in individual contributor roles within either as an MSL, I was really roll up your sleeves, get it done, whatever it takes. However, moving into a leadership role where you have a team, being a doer is great, but you now have to empower others. And the things that made me successful as an individual contributor role weren't the things that were going to drive success as a leader of a medical affairs team. And thinking about what do you have to do in these different aspects of your career? And you may ebb and flow. And I have heard from a lot of managers, mentors, leaders that I think a lot of and have respected for a number of years, also moving and flowing from potentially a leadership role with a team to an individual contributor role in and out, right? As you grow parallel or incremental strengths. And so being able to remind ourselves of those things and what do you need to lean in on at different aspects and different parts of your career, I think is really important.
I think that going from an individual contributor role to a people leader role, leading teams, as you said, is oftentimes an overlooked transition that really, I think the advice that somebody gave you about what got you here won't get you there. Because a lot of MSLs that do transitions because they're great MSLs, but that skill set is not the skill set that's going to make you a great people manager. I knew you would be a great people leader. It's your overall general curiosity of figuring out what it takes to be good in the role you're in, even going back and forth in between individual contributor and people leader roles. I think that is the mindset that you have to have in order to make that transition back and forth multiple times over a career. Yay, I applaud you on that. Okay. Let's talk a little bit about failures here. Which failure or apparent misstep set you up for a later success in your career?
This particular example, I always love to give, and it's not a new one, but it's had such an impact on me from early days. I was doing my PhD at UCLA, and I remember we were doing some really innovative, cool work with novel diagnostics in the oncology space. And we were also looking at some essentially nanoscale metrics to create a fingerprint of what we were trying to pull forward as a diagnostic technique. And I was doing a lot of analysis of these data, and I was so excited and came to my advisor and I presented the work. And then I went away and I thought, oh goodness, as I was rechecking everything I was doing, we were getting ready to submit a publication. I was off by an order of magnitude in the calculation I had done, which was huge at that time. And also, I don't ever want to be off in my data analysis and put these things out. And so I thought about it for a few days and I went, okay, this is real. I've got to come back as soon as I can and just talk to my advisor. And I was terrified to go in there and say, I made this mistake. Here's what happened. And he was fantastic. He just listened. He said, Sarah, I'm so glad we caught this now. No big deal. We're working on the publication. We can easily make updates. We had the luxury of being able to be in a position where it wasn't necessarily impactful for any outcomes that had been delivered, but it made me realize that recognizing when something is wrong and going back and essentially failing fast, right? Going back and having that conversation with people who can help you and help support and navigate it is fundamental to then moving forward and righting the ship. And so that has been a lesson I hold with me throughout my career, which may seem very simple in a ways, but it was fundamental for teaching me that it's okay to have a misstep. It's okay to fail. And if anything, we've all done it. You'll find people that lean in and help you overcome that. And that's the best thing we can do is fail fast and then move forward.
Yeah. I love that you learned that early, like before you really got into even your medical affairs career, because it took me a long time to learn that. But I absolutely 100% agree with you is that when you fail, you got to own it, move quickly to let others in to help you problem solve, and that the fear of letting others know that you've failed shouldn't be something that stops you from engaging others. And I think that is it seems simple, but it's very hard to do because it is, especially depending on what the mistake was and whether it's analysis or something said, let's put it in context of MSL, something you said wrong to an HCP, or as a leader, some information you weren't supposed to share was shared. Those are the types of things that happen all the time, and just owning it and moving quickly to rectify it is with others' support. I think it is an invaluable lesson. I love that story. Okay. In your opinion, what separates an exceptional leader from a good one?
I always look at this in terms of who I've had the luxury of being under, and I've had the luxury of being under a number of different leaders in my career. And I think the things that have been most effective for me are the individual leaders who understand how to lift up team members, what's important for team members, their individual goals, what are the things that drive people, because our drivers are all uniquely different, what we're trying to get out of our work life, but all of everything we do, but also those that can take down barriers and help you as a team be effective and efficient. And so I think those leaders that find those synergies in terms of team culture and being able to drive individual performance, but importantly, team performance, has been absolutely some of the best leaders that I've seen in my career. And I would say last but not least, those leaders that can do that, but then also drive the team to be go-getters, right? Ambitious. We let's face it, we're all here for patients at the end of the day, no matter what role. And so time is of the essence, whether that's engaging with a healthcare provider, with our KOLs and scientific data, whether that's bringing forward something to help impact patient outcomes, like all of these key elements are critical. So the more we can have leaders that take barriers away, drive individuals, but importantly, drive team culture, high performing, I think let's lean in on that because that's what good looks like, in my opinion.
Over the years, we have regular conversations. And one of the things that I have noticed about your perspective on this is that it's like some that are good leaders, but they weight things more towards the individual or the team but your perspective has always been that it can be both. You don't have to sacrifice either in the equation, right? And so I think that is the art of being an exceptional leader.
Great way to synthesize it. I agree because I think you need high performing individuals, but we have to perform as a team to drive business and drive outcomes. And so finding that balance it's not easy, but I think it's really important.
Absolutely. Absolutely. All right. How do you define success in medical affairs, and has that definition changed over time?
100%. And I think I always point to you, Acceleration Point and team, on the amazing work you guys do in terms of, I look back, gosh, decade plus ago, and the things we used to measure when we looked at success were very simple. They were numbers, they were ends, they were interactions, number of educational programs, things of these sort. And fast forward where we are today, it's how are we driving behavioral change? And of course, those things don't happen overnight and they're harder to measure, but we're now getting to a place where we can measure that and where we can see that over the continuum. And I think that's what matters. That's ultimately what we're trying to get at, because if we do 200 interactions, but we're not moving the needle, then how are we being impactful in our role? So that's what I think is really important when we think about success in med affairs. And then I think also not only creating behavioral change for the positive, but what does that mean? And so when I think about it, it's then downstream impacts for patients, right? Better health outcomes, quality of care outcomes, all of these things that drive impactful change for the patients at the end of the day.
What I love about your new role is that you're bringing the patient voice even in this aspect of the conversation internally. Right now, what we call impact, the care gaps is the buzzword right now. And one of the things that I think that your role is going to bring to the forefront is figuring out how the patient's perspective on decision making can be integrated into outcomes and what impact is. And so I love that your role is bringing the patient voice even into this conversation. What's the worst career advice you see commonly given to rising medical affairs professionals?
I think for me, it goes back, and maybe because I experienced this, it's that you need to have had this specific experience within medical affairs to be effective to deliver on med affairs roles. And while I think there's a lot to that, and I think there are those that have been in medical affairs, MSL roles, and grown headquarters roles, and really provide incredible understanding and ability to do that job in a capacity that obviously somebody who hasn't done it wouldn't have. There is unique, I would say, skill sets we bring especially when we think about building out diverse teams and bringing different experiences. So again, I lean back on not everybody who can come into a medical affairs role can just absorb it, take it on, and drive and grow with it. But I think there are a lot of individuals who can be successful without having that dedicated prior medical affairs experience. And as a leader thinking about, especially if you have a team, as I mentioned, that you're building out, what are the right skill sets that you're bringing in that can feed off of each other? And sometimes those orthogonal ways of thinking takes away the blinders that some of us have when we've been in medical affairs for many years. And the way we do things is the way we do things. And yes, we're evolving, but sometimes we're still have this lens. And so being able to bring some of that cross experience, I think, is really valuable.
Yeah, especially for people like you who have stepped into, gone back and forth between different roles. One of my previous podcasts, at least, said that it, he's a leader who happens to be in medical affairs versus a medical affairs leaders. And I think that's what I've noticed, that same sort of mindset that from our conversations is that you have a leadership role and you just happen to be in the medical affairs space. And I really think that way of thinking is what really is going to elevate our profession. Okay, so what belief about medical affairs did you hold strongly 10 years ago that you've completely changed your mind about? And I think it might be related to a previous answer, but I still want to ask the question.
Yeah, this one's always, I always feel like this one I laugh at because, again, going back to earlier days in medical affairs, I remember even saying what people would talk about, what other metrics can we measure? Oh, we can't really, we can't look at these things and in a different way. And we still came back to the same kinds of number outcomes, KOL engagements, all the things we were mentioning before. But that really has completely gone by the wayside. And now, again, I point back to the great work you, Linda, and the organization that you lead in Acceleration Point from a medical affairs perspective. And driving that has really helped evolve the field. And where we are today is vastly different than I ever imagined a decade or so ago.
Well, I think your role speaks to that, right? I think it's the natural evolution when we start pointing our impact story to the patient outcomes. It's a natural next step to directly engage them. Yeah, I love that. Okay. What new skill, mindset, or technology do you believe medical affairs professionals must adopt to thrive in the next decade?
Yeah. For me, there's two really critical ones. I think the first one is about being able to navigate change. I think we're in an era now where technology is shifting remarkably fast with the advent of AI and all of the work we do. And there will be more things to come. And so I think, and not only that, right? That's just like a landscape perspective. We have many other factors that are shifting and changing, whether that's organizational change, that could be the ways that we're looking at how we navigate even the regulatory environment and infrastructure as things change. So being able to thrive in change, I think, is really critical. And that means that we have to let go of having certainty all the time and being comfortable in what we know and what we control, but being able to find the things when things change that can be steadfast, but also lean in on the other aspects. And sometimes this goes back to running pilots and failing fast when we go through change to be able to drive success. But I think that's particularly important when we look at the medical affairs role. And I expect that we will continue to see many shifts in the coming years, particularly as it relates to technology and the way we engage with our stakeholders. The second piece, I would say, is the ability to flex our scientific muscle in a forward-looking capacity. And this was impressed upon me, I don't know, maybe mid-year into my medical affairs career it's great that we can really think through the scientific data. It's great that we can provide a compelling narrative about the data and the stories that we're telling around our science. But we also have to be able to not just understand how to bring back insights from the field, but importantly, think about what are those things that we hear that are going to help us think and look around the corner and be strategic thinking. And I think being able to look around the corner, predict gaps as it relates to evidence generation or shifts in standard of care or perceptions that we're starting to see and get ahead of that is 100% one of the things that we should focus on in the med affairs field, because it allows us to then go back internally and say, if we understand that this is going to be true, and of course, you never have a crystal ball, we do our best to gather as much data, insights, and things that help point to these things we should focus on. But what are the gaps? What are the things that we need to focus on now so that when those changes take place, we're ready for them? We have the data. We're ahead of the eight ball, and particularly in the R&D environment, especially in some of these very complex, crowded spaces, having that ability to be forward-looking is, I think, going to be really impactful for the medical affairs teams.
I love the phrase looking around the corner. And I do think that with even combining your sort of two categories, topics together, for lack of a better word, is like being able to navigate change, but not forgetting to look around the corner. Together, it's it it's so critical for the state of affairs today, but it's also, I think what people don't understand is a practice skill. This is not something that you're born with, but it's something that you can develop that it becomes a habit to understand that change happens, practice the way you respond to it, but always keep in mind about something's gonna come around the corner that's gonna create change again, and you gotta be ready for it. So I really love that's the 2 areas that you focus on, because it's so easy to say things like learning AI, but really it's the human element that we have to get better at. So I love that. Which leads us into the last question on the professional side. What do you think the future holds for medical affairs?
I, I feel like, first of all, I feel like the future is bright in med affairs. I think it just continues to be a core function within the biopharma industry that is leading the way. I think we will see more and more interest in terms of medical taking on leadership and of the voice of the organization in terms of communicating messaging and things. And partly because I think, I'm biased and I do feel like we're going to start to see more advent in terms of engaging in patient communities and patient advocacy organizations from a scientific perspective. But as we see in the data, many more people are wanting access to data, to information, to making their own informed decisions. And so we're moving in a way, and again, maybe this is my bias, but I believe we're moving in a way where we as humans and individuals are craving that. And to me, medical affairs has always been poised to deliver on the data and on providing insights and information and giving our healthcare providers the information to make informed decisions and have a better scientific understanding in the therapeutic areas that we cover. And so I think that is only going to become more critical as we move forward in the future, and having that ability to take content and make it snackable, digestible, retainable is going to be another factor that we continue to push on, which we have done for years. But in a space where we work with physicians that have very little time and being bombarded, I do think that is a critical importance for medical.
This is where I think the access that every individual has to the AI tools is making a shift in the way we have to think as medical affairs on who the stakeholders are and what they're going to find somehow. Why not lean into figuring out how to engage with them so that they can get higher quality information that they're probably going to feed into? It's no longer Dr. Google, it's Dr. AI tool, fill in the blank. And people are going in with higher quality questions, better informed for whatever their clinical scenario is. And I think that conversation is something that we have to figure out how to navigate as we evolve the medical affairs profession, because it's going to happen with or without us, and it's better for it to happen with us. All right, now we're going to switch to the fun part. I love all parts, but the really for the listeners to be able to get to know you as a leader, and so they're more personal questions. And the first one is, what advice would you give your 30-year-old self knowing what you know now?
Yeah, great question. So for me, it would be being content in the moment. I have always been a tenacious individual, partly because I'm so curious and I love learning. But I also, early in my career, I really wanted to know what was the next step? What did I need to do now to be where I thought I was going in the next 1, 2, and 5 years? And it was always a little bit in the back of my mind. And I think having gone through different aspects of our industry and in different roles, I think we have, for me, I would have wished I'd taken a step back and just been really present in learning and doing what I do well, knowing that I was surrounded by incredible mentors, by incredible leaders who will support me in what I'm doing and help get me there. And I think the other part of that is in the same vein of really wanting to plan and know what was next. I also thought that there was let's say, maybe not necessarily one way to get to development, but I had a very kind of narrow-minded approach. And I think that to me, it's being open to really taking the opportunities that come to you. And sometimes those are really orthogonal things that may come out of the blue that you don't expect. And I had a great discussion with another leader recently who said, for me, some of the best growth opportunities I had were not the ones that took me to the next quote unquote role or grade or whatever the level was within the organization, but some of the parallel moves that they also made that made them more robust and well-rounded and then served them in their leadership development. And I don't think when I was navigating some of my earlier career days that I recognized that. So those are a couple things I think if I could look back and do things differently, that would be it.
What I love most about that perspective, in terms of what you would tell your younger self, is that the view is not just forward when you're thinking about developing your career. And I love your use of the phrase orthogonal, because it it is. I stepped into a few kind of non-traditional roles that were considered probably on the scale of promotion, a step back or over or under, I don't know. Didn't care. That wasn't the point. It's that it made me think about what I could contribute to the medical affairs profession in a different way. And through our conversations, I would say that is one of the things that we always end up talking about different ways of looking at it and reaching across to other professions to challenge our way of thinking. And so I love that perspective. Who had the greatest influence on how you lead or mentor others, and what did they teach you?
Okay, this one is so easy. It is you, Belinda. I truly, had I not gotten the opportunity to meet with you and discuss medical affairs and hear your passion and enthusiasm and just really, you were that catalyst for me that made me want to go into this industry. And you taught me many things. And along the journey, you have taught me things, everything from, okay, let's think about how you do get into the industry and find your first entry point, to how do you navigate moving from an MSL role to a headquarters role to, okay, now I'm taking a different position within another sector of industry. What does that look like? And how would you navigate that? All kinds of things from, gosh, I'm having this challenge with how do I get my team to be more high performing? These are the things that I know to be true. What would you do? You've really been that amazing resource in terms of not only helping me think differently or provide your expert opinion or advice, but also sometimes making me just talk through something and come up with it on my own, which has been incredibly valuable. And I know you and I talk about our appreciation for all the conversations that we've had, but I think that's also really great leadership, which is not just giving people some kind of resource or providing some kind of answer, but it's actually listening and letting the person navigate in their own mind how they would overcome a challenge or a barrier. And you've served in multiple capacities for me in that way. So really, I can't say thank you enough. And yeah, it's been just an absolute pleasure always to have your expertise and mentorship in my life.
First of all, I'm honored. I l I appreciate you saying that, and for those of listening, Sarah and I have it was a long over a decade ago, I don't even know how many years now, maybe even 15, 12, 13. I don't know. It was a long time ago when we first had a conversation in that little cafe in Evergreen, Colorado, and we have always stayed in touch, and more recently, in the last 5 or 6 years, we have regular conversations. I know you always refer to me as a mentor, but it changed for me a while back where it was just two professionals trying to figure stuff out through conversation, and that's what it means to me. So I want to say thank you back for being one of those people that I feel like I can just have really meaningful conversations to brainstorm crazy stuff that's happening in our profession and personally. And thank you back.
It's amazing. Thank you for sharing that. I'll say, I wouldn't be where I am without you, and I so appreciate you. And I think having a strong woman in my life that we can have these regular conversations and lean in on and lift each other up is just second to none. So thank you so much.
Heart. I get a little heart as well there. What are one or two books or other resources, podcasts you most frequently gift or recommend to peers or friends, and why?
You know this, Linda, but I love building my curation of resources, books and podcasts and all the things. And I'm always asking people, what are you reading and on leadership or other opportunities to grow our skill sets and build out my toolkit, if you will. But I always go back to the same two that stick with me. And truly, if I am mentoring somebody else and finding what are the things that I think have really stuck with me, there's two books that I absolutely would recommend to anybody listening to this. So the first is Lean In by Sheryl Sandberg. It's not a new book. I think it was around the 2015 timeframe, if I'm not mistaken, that it might have come out, but it's fantastic for many reasons. And I will say I probably either read or listened to this on audiobook maybe 7 times at least by now. And when I need a reminder of something, I'll just go back and find certain chapters where I now know where things sit and I'll refresh myself. But it is a great book in that it talks about females and women in leadership roles, but it talks about the importance of finding sponsors and mentors and sponsors. And some of those are other strong women, and some of those are strong men that can lift us up and find ways and avenues to help advance us. And so I think for anybody who has not read that, I think that's a really great message that comes through. The second message I love from that book goes back to what you and I were talking about earlier in terms of maybe our career paths are not only linear in this one way, and we've got other options. And I think the quote is around life is a jungle gym, not a ladder. And it's it's either finding those other people, mentors, sponsors who can help you, or those other opportunities, growth opportunities, exposure moments, experiences that get us ahead. And sometimes they really are all around and not necessarily straight up and down. So from that book, Lean In, I think is fantastic. The other book I absolutely love, and I think this is really critical when we think about teams, is Radical Candor by Kim Scott. So this talks about leadership being like a framework in the way that we care personally about our team members as a leader, but we also challenge directly. And I think those two things go hand in hand. And there's a great, I think it might be the introduction of this book, which talks about a team, and one of the members of the team is really a fantastic person. People love this guy, right? He's just a good guy. People resonate with him, but he's not pulling his weight in terms of the actual work being done. And so rather than confronting this individual, giving the really candid feedback, this sort of behavior within the team continues to go on. And long and behold, long and short of it is the other team members, the team ways of working erode because they're now taking on responsibility for this other individual who's not pulling his weight. And so the takeaway from this example and the things that Kim Scott goes into is being able, whoever individuals are, being able to provide timely and candid and maybe challenging feedback, but do it in a way where you care. You really care about that individual. You're helping them, you're helping the team, you're helping the organization. I think that is something I continue to go back to because it's not an easy thing, especially when you're dealing with really fantastic people from a personal level and you have to give them critical feedback. Not an easy thing to do, but I think having that framework of why it's so important will help individuals potentially who are listening again in their leadership and growth and way of having high-performing teams. I should say developing high-performing teams.
I've read Lean In. I agree with you. It's a great book, especially women leaders should, but I would say it's a great book for any leader. The Radical Candor, I haven't read yet. I'm going to go read it now that you have recommended it. But because like you, I like to just consume books like crazy. But one of the things that some of the hardest decisions I think a leader of people have to make is exactly what you're referring to is when somebody is a high performer individual, but they have a toxic impact on the team dynamic. That at some point, if the radical candor, shall we call it, doesn't have the impact or change the behavior in a way that this individual still has a high level of performance, but cares about the team performance as well. This is another area where I have a mindset that it may need to be challenged. I don't know, but it's a kind of a fail fast. I feel like if a team member, no matter how good they are individually, is bringing a team down, it that is a bigger issue to me. So I think there is a balance there, and I don't know if I always get it right, but I always have a mind to the impact that everybody has on the team dynamic. So I'm going to go read it.
Yeah, I agree. I think, and you have taught me that too in my career, which is we all want to lift individuals up and create the most opportunity for individual team members, but team performance as a whole is so important for team success and organizational success and for, quite frankly, delivering, again, going back to delivering on why we are in the biopharma field for patients. So if I hadn't talked to you, I know on a number of occasions, it would have been more challenging to fail fast.
Awesome. All right. What is a small or uncommon habit you practice that has had an outsized impact on your effectiveness or well-being?
So I am a big mind body person. I always have, whether that's doing yoga or some kind of physical activity. I think I told you I love jumping on the Peloton. But one of the things and so that's not uncommon. I think a lot of people do that as an outlet, right? For us, get our body and our mind going, taking a break from the mental work that we do all the time. But what I have learned over the years is I used to always think I need an hour. I need an hour in my day to really be effective in my quote unquote workouts. And that's not always easy to do when we're traveling around and we have a lot of priorities. And so it's taken me a long time. And I think part of it actually is through some of the incredible leaders that Peloton has as their instructors who, their perspective is just take 20 minutes out of your day, whatever you have. It could be 10 minutes, but do something and move. It could be lifting up a couple of light weights. It could be walking around the block. It could be, yeah, maybe you have the luxury of a 45-minute cycling ride. But I do think that's been a habit that I've more recently picked up, which is I only have 20 minutes today, but I'm going to go do something. And I feel so much better after doing it.
I agree, and I've been trying to build a habit of getting out and walking away and giving the opportunity through movement and activity to also think or sometimes even just quiet your mind sometimes helps, I think, with that. So I love that habit and that mindset that if you can't do the hour, doesn't mean you don't do anything. You do something, and I think that's a really great habit. Great recommendation. This might be a little bit of an overlapping question, but how do you recharge or maintain resilience when work becomes intense or overwhelming?
For me, I actually think through what's most impactful in order to be resilient when things are stacking up, when it truly, I feel like you can't get your head above water and you're just barely treading, is actually prioritization. And I know we talk about prioritization in our field all the time, but it is so important. And, you know, for me, it's about making a list. And literally, I can't tell you, I have a old school notebook that is just for list making on what are my to-dos, what are the priorities, when is it due, what's the impact to the business needs, and by when is it needed. And I'll just start scratching these things off when if something takes 10 minutes, I'm going to do this thing. If something needs really 2 hours of me dedicating time, let me buffer that in. But I think the other part of prioritization is not only understanding what to start with, because if you're paralyzed with too much going on, oftentimes you feel like you can't start anywhere. So that's a really good approach to just starting somewhere. But I think the other part is if you find something continues to stay on that prioritization list week over week, month over month, and nobody's coming back to bother you for it, let it go. Some of the best advice, again, another mentor gave to me that actually made me step back because I was like, oh, I would never normally not do something that somebody had asked of me. But they said that. They said, if something really is not, somebody's not coming back to ask for that thing that they needed and it's been a long time, it falls off the list. It's not that important. And so by not advocating we let things fall off the list often, but I think that's another thing in the context of when we look at all the work we're doing, how do we prioritize? It's another pro tip that might help if something's really not critical to the day-to-day or to the business.
Yeah, I love that it's not just putting things on the list, but learning how to take things off the list. And when we've had this conversation before, I told you it reminds me of those professional organizers who give advice on how to clean your closet. And they something along the lines, if it hasn't been worn in X number of time, it means you don't need it, or just get it out. And that's what like the scratching something off the list that people don't care about it's the same concept. And so I really love that advice because it's both ends. Okay, figure out how to prioritize, but also deprioritize. All right, fun question. What purchase under $100 changed your life?
This one is hysterical, but I recently discovered a free app called Alta, ALTA, if you haven't heard of it. And then maybe some of the MSLs who are listening can resonate with this. But you travel a ton, right? And oftentimes, if you're like me, you only want to bring a carry-on no matter where you're going, how many events you may have planned or different things. And I tend to throw everything in the kitchen sink. And then next thing you know, I'm sitting on this darn carry-on trying to zip the thing up. And so for me, this app has been great because you can, if you take a few minutes one weekend, just throw some things in there. You can actually put it on a calendar of these are the things, gonna put it in. And I can tell you, I did this first time on a recent trip, and I was beyond impressed with how much I could just cut out of my suitcase. And then I had room for that was in this case a fun trip. So I had room to add things during my vacation. But yeah, it's maybe helpful for those of you who travel a ton and are not necessarily good at only limiting yourself to X number of shirts and skirts and pants and things.
Yeah, I remember the struggle of the mindset of wanting to have options wherever you are, and so you end up packing more. But I agree, even for long trips, I hate having checked baggage, and that's a great app. If it helps you really prioritize, shall we say, what you're gonna take, and also to leave room for I love that, is leaving room to bring something back, something fun back, whether it's work or vacation. That's a fun perspective to have.
And maybe it's unique to me. I always used to joke that if I wasn't in med affairs, I would be in the fashion world or something. So it allows me to do a little bit of weekend move into another zone and headspace, but it was quite fun, I have to say.
That's awesome. All right, the last question and the fun question that I love is, if you had a giant billboard visible to everyone in medical affairs, what would it say and why?
For me, it would be very simple and it would say future forward. I think this gets at a lot of what I talked about, which is change is here to stay. It's inevitable. We really do need to embrace that and learn how to think in a forward looking way. I think going back to that, how to look around corners, right? Really thinking about the future is where we want to get ahead of today for 5 years down the road. So being that strategic voice to bring back those insights that really can inform what the future needs to look like and help get ahead of evidence generation and all the things. And I think the other part of future forward to me is really continuing to evolve medical affairs as a core pillar of organizations within the biopharma space. You and I have talked about this for a long time, where historically we were a sub pillar. And then I had the luxury at one of my organizations of they took a stamp and they said medical affairs is one of the core pillars leading the ship on all things, whether it was brand planning or you name it. So I think now we're in a place where we're going to only see more of the importance of what medical delivers, both from a field and a headquarters perspective to drive our business. So I would say those are the things to me that really, when I step back, is the underpinning that future forward billboard, if you will.
That's a beautiful way to wrap up this conversation, because I really think that you are an exceptional leader. You have a perspective and a sense of curiosity that elevates not only your own personal growth and path, but those around you. And it's been an honor to be able to be along that ride with you, but to continue our conversations that I always look forward to. So thank you for being on my podcast.
Thank you, Linda, so much for having me. And kudos to you and all the incredible work you do, not only for the field, but I think hearing the next generations in medical affairs, I can only imagine what they're going to learn from all that you impart on us continually, both whether it's opportunities like this through podcasts or all the great work that you have done and continue to do for the field.
Thank you.